Did you know there are about 2.2 billion kids in the world, and a lot of those kids are stuck at home right now due to the situation? We have an expert with us to tell us about how that's affecting their mental health, their physical health. We have Artie Gamire from Salt Lake Community College, your licensed clinical social worker. Thanks for joining us. What are the issues facing our kids when they're stuck in self-isolation?
Well, thanks for having me. Right now, with the pandemic and isolation, our kids are suffering more than ever. Some of the signs and symptoms we're seeing are increased anxiety and depression, irritability, boredom, difficulty concentrating. Kids are struggling in school. And for kids who have pre-existing mental illness, their mental illness is even getting worse. And another important thing to keep in mind is our kids are also in increased risk for abuse and neglect with isolation and being stuck at home all the time.
These are really important things to remember in the debate about going back to school, opening things back up. Thank you for bringing these up. What are your suggestions for helping our kids feel better or feel safer when they are stuck at home?
One of the important things for parents and caretakers to remember is to take care of their own mental health issues, because a lot of times when we're stressed, we're projecting that into our child and our children's day-to-day life.
Stressors, aren't they?
Yeah, definitely. And I also encourage parents to get professional help if they're seeing these signs and symptoms in their children, like, their sleep routines are messed up, they're having nightmares, they're endorsing more clingy behaviors. I also want parents to really take in consideration of their sleep routines, because especially with our teenagers, they're struggling with sleep. So they will not go to bed until like 2 or 3 in the morning, and next day they're struggling at school doing their Zoom classes, and then they're sleeping like 15 minutes, 20 minutes throughout the day, and that's not helping at all. Also, maintaining social contact with other family members, whether it by Zoom or any sort of connection, is important. But we also have to be careful how much screen time kids are using, because a lot of screen time is also not doing that great to their mental health recently.
Okay, that is good to remember, and probably get outside and all that stuff that we know. Where can people find more info from you? Can they get in touch with you directly? I guess I could put your info on our website.
Absolutely. Feel free to reach out to me as well. And then the National Institute of Mental Health also have amazing tips on how to take care and navigate our kids suffering through isolation.
Hey, thank you so much. Very interesting topic and something we all can be mindful of with our kids at home. Thanks so much, Artie.
Thank you.